Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is how to non-operatively treat sciatica. Sciatica is pain that occurs in a person's leg due to a pinched nerve, and it's usually from a herniated disc. It could also be from spinal stenosis. The sciatic nerve is actually a confluence of three separate nerves. You can see here L4, L5, and the S1 nerve root come together to form the sciatic nerve, and then it comes out of the pelvis and runs down the back of the leg. If one of the components of the sciatic nerve is pinched as it's coming out from the spine, it can cause sciatica with resulting symptoms. At any one point in time, 1% of the population is actively suffering from sciatica. Well, with regard to the symptoms, it depends on which nerve root is being pinched. Usually it's one of the two bottom levels, L4-L5 or L5-S1. It can lead to burning, searing pain, or a tingling sensation with pins and needles, cramping, numbness, and even weakness. Just because a nerve is getting pinched doesn't mean it's going to hurt. That actually is not painful at all. It's when inflammation is sparked up because of that pinching, that's when sciatica occurs. Well, how's it diagnosed? History and physical exam is crucial, along with an MRI and maybe a nerve conduction study. What you see the doctor doing here is called a straight leg raise test. Lifting up the leg while it's straight puts tension on the sciatic nerve and will cause an exacerbation of a patient's pain, and then they'll bend the knee, and now oftentimes the pain will go away because the tension is off. Here's an MRI. You can see, and this is a cross-section, a large disc herniation at a level here, pinching on a nerve root as it's trying to get out. Now, where a person's going to have pain, it just depends on which nerve's getting pinched, and not everybody walks out of a textbook. So most L4, L5 disc herniations will pinch on the L5 nerve root, and as you can see, L5 is on the outside of the calf, and although it doesn't show it very well here, it's on the outside of the leg coming down, and then it wraps through around the outside of the calf. Okay, S1 is mostly on the back of the thigh, and then L4 is on the outside of the leg, over the knee, and down the front of the thigh. But as mentioned, not everybody appears right out of the textbook. Muscle weakness is more concerning than simply numbness, and it may be an indication for surgery, especially if it's not getting any better, definitely if it's getting worse. It's unclear how long that can be watched until it truly becomes irreversible. So here are some functions. Extension of your knee is mostly L3 and L4. All right, lifting up your big toe is pretty much strictly L5. Lifting up your ankle is mostly L4 and L5. So, all of these kind of come together to encompass mostly just two nerves. But you can pretty much figure out whether there's weakness or not, especially since you have two. You can compare it to the other side. Here's some non-operative treatment options. First and foremost, medications may include over-the-counter anti-inflammatories and Tylenol. Medrol Dose Pack is a prescription 5-day dose of prednisone, which starts out as a burst of prednisone and then tapers off over 5 days. That can be helpful. Narcotic medications, muscle relaxers, neuropathic medications such as Lyrica and Neurontin, and the topical prescription pain creams. Physical therapy can help, chiropractic treatment, acupuncture. Spinal decompression therapy, such as you see here, is computerized intermittent traction that can help pull pressure off of the pinched nerve. Interventional treatments may include trigger point injections, which are great subcutaneous injections for spasms. Epidural injections consist of a series of maybe 3 injections. If the first one works, then you might not need the other 2. But they can be repeated every few months. Here you actually see a needle going into the area around the nerve that's getting pinched. There's the disc herniation, and bathing it with soothing steroid medication. This is not a fix for the problem. It's a proverbial Band-Aid. There's 75 to 90% effectiveness with the epidural steroid injections. What are the outcomes with non-operative treatment for sciatica? 80% recover within 6 weeks, 90% recover within 6 months. Studies have shown that the outcomes at 1 year are identical between operative and non-operative treatment. Now, having said that, remember, if you have increasing muscle weakness, you should consider surgery. If you have Cauda-Equina syndrome, that's if there's a large amount of compression on the area where the spinal cord is ending, that should be operated on within 24 hours, absolutely. So symptoms to watch for include the muscle weakness, the incontinence, and if symptoms are getting worse rather than better with treatment. The top sciatica treatment in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. GeorgiaPainNetwork.com is the website to visit, and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.